Hi, I'm Donna Vellinga, the Executive Director of Manasota Solve Maternity Homes, as well as a board member of Healthy Start Coalition. Congratulations, you're going to be a mom. What a great time. It's also an important time for you because you need to be very careful about what you eat, drink, and your activities, because everything that you do now will have an effect on your unborn child. The information that's going to follow will help you to make good decisions so that at the right time you will deliver a happy and a healthy baby.
Hi, my name's Michelle. I'm a care coordinator with Healthy Start of Manatee. And today I'm here with my friend Jessica, and we're going to talk about how a woman enters the Healthy Start program. Hi Jessica, how are you?
Good, how are you?
Today we're going to talk about how a woman can become a participant in our Healthy Start program. I know you've heard a lot about the Healthy Start program and how important prenatal care is. You're probably wondering how a person comes to be a Healthy Start participant and what we look for to offer services to a woman. The process really starts, Jessica, on your first OB visit. You'll be asked to fill out a prenatal risk screen. This is a simple questionnaire in easy language, and it's just pretty much a checklist for you to go through. And what we do is we look for certain risk factors on the screen that helps to identify our participants. Some of the things that we look for, Jessica, are risk factors considering your age. If you're under the age of 18, it's very important that we look at you as being maybe a riskier pregnancy, and we like to offer services to all women under 18. So that's one of the things we look for. We also look for your marital status. Being single, you can lack things such as financial support, emotional support, physical support. There are resources in our community that we can hook you up with to help you deal with these. So that's another risk factor that's located on our screening tool. We also look at weight on the screening tool. A body mass index or weight under 110 pounds indicates that you might be at a higher risk to have a low birth weight baby, and there might be some nutritional factors there that Healthy Start can help hook you up with. So weight is one of the things we look for. Then the questionnaire goes on down in the middle section to ask things like, do you have problems getting to appointments? Maybe you have a transportation barrier. There are things we can help you out with on, if that's a problem. We ask if you have moved more than 3 times in the last 12 months. We try to get an idea of how stable you are as far as are you living in a place that's going to be healthy for you and your baby? Do you have the support you need? We ask things, 2 very important questions about tobacco use and alcohol use. These are also risk factors for having healthy babies. We know people that smoke or have alcohol use have babies that are low birth weight or premature or might have problems. So we try to identify these early and hook a young lady up or woman up with services in our community that would help them in those factors. We ask questions about depression, past mental health counseling, things like that. Healthy Start Services offers some psychosocial counseling, and we also offer referrals out into the community to help a woman through maybe anxiety with pregnancy and things like that. So all these items are screened in the middle, and then as we come on down to the bottom of the screen, you'll see questions regarding past pregnancies. We like to know, was there problems with a past pregnancy? These also indicate a higher risk factor for a young woman to be involved in our program. And basically what happens at the end of the prenatal risk screen is you just fill it out, and then your doctor scores it down here just like you would a quiz at school, and these are sent to our county health department. At the county health department, they're sorted according to score, and then if we feel the young woman that filled out the screen could use Healthy Start services, these are sent to our care coordinators such as myself. And then a care coordinator usually contacts you with the phone number that was put on the screen. So that's one way to come into our program. Another way would be, let's say you had a friend who was pregnant. Maybe she didn't score high on her prenatal risk screen and a Healthy Start care coordinator never contacted her, but she's interested in some services, maybe has an issue or two, or just would like some community resources. She can contact our local office and speak to a care coordinator. We would kind of interview her on the phone and see what kind of services we could offer her, and then she could become a participant in our program through being a self-referral. So it would just take a phone call, okay? And we also screen infants at the hospital to come into our program. When the infants are born at the hospital, the nurses fill out a infant risk screen, and it's similar to this, and it asks questions concerning the mom and the baby. And a few of the questions on the infant risk screen concerning young moms would be whether they have graduated from high school, whether they're married, how old they are, kind of the same things that were on the prenatal to let us know maybe there are some things we can help that mom out with. So that wraps up how one becomes a Healthy Start participant. For more information on this program, please contact your local Healthy Start office. We are here to help.
Good morning, my name is Yvonne Bundridge, and I am a care coordinator for Healthy Start. And this morning I'm going to be talking about risk factors, those risk factors that Healthy Start looks at to make sure we try to help mothers eliminate so that they can have a healthy start, so that their baby can get a healthy start. And one of the first ones I'm going to talk about is being a mother may be under the age of 18. And if you're under the age of 18, you may not have parenting skills. And so therefore we try to provide you with a referral to make sure that, you get into parenting classes that can help you take care, and give you the information you need to help you raise that baby. We also, if you do not have a high school education, that may limit your job opportunities. And we try to help you, get your GED or make the referral to you to different agencies that could put you through classes to get your GED so that, you would be able to find a job to help you take care of your baby. We want to make sure that you have family support. A lot of the mothers do not have family support. And if you don't have the father involved or you don't have family support, then we try to get you in with an agency where that you could get support for your baby. Another risk factor is you could have a medical condition that could affect the fetus, such as diabetes. And with that, we want to make sure that you will, if you have any type of medical condition, not only diabetes, but any type of medical condition, we want to make sure that you will we encourage you to see your doctor and to make sure that you discuss your concerns with your doctor, because a lot of times, we have people that they're afraid to talk about, what their concerns are. And so we want you to make sure that you open up and make sure that you, discuss everything that is of concern, so that the doctor can help you, and make sure that you are getting the right care that you need. Also make sure that you go to your scheduled doctor appointments. That is very, very important, because a lot of times that they could find things that is going on with your pregnancy that can help you and help the baby. Another risk factor that we look at is if you're smoking. Smoking, we all know that smoking can affect your fetus. And it can cause a baby to have upper respiratory problems. And so we want to, encourage you to, get into smoking cessation. I see you're smiling, but hope that you're not smoking at this time. But, smoking is not good for the baby. And then the secondhand smoke is not good for, the people that, if you have kids or the people that are around you. And so we try to get you into smoking cessation classes to help you with the, to stop smoking. Another risk factor is, that we look at is, if an individual is African American. As an African American, we have it has been determined that we have low birth weight babies. If we can eliminate these risk factors, then we have a better chance for your baby to grow up to be healthy and normal. Thank you.
Hi, my name is Ingrid Dorian and I'm a care coordinator for the Healthy Start program here in Manatee County. Healthy Start works with both pregnant women and babies birth to 3, providing them services, information, and support for them to reach a positive goal, for their baby to be born and remain healthy. Healthy Start has put together a group of professionals to provide you with valuable information for you to make the right choices now that you're pregnant, because we want you to have a healthy, happy baby. I myself, as a mother of 2, know how important this information and these services are and what a difference they make. So be sure, whenever in doubt or in need of support and services, give your care coordinator a call. We are here for you.
My name is Paula Termini. I'm a registered nurse with the Healthy Start Coalition. Today we're going to talk about, with my friend Jessica, the importance of prenatal care. Prenatal care may start even before conception. During the first several weeks of the pregnancy, the organs of the body, the heart, the lungs, the brain is all developing. Early prenatal care helps to provide careful observation of the mother and the pregnancy to prevent or avert or identify complications that may affect the outcome of the pregnancy. In the first prenatal visit, blood work is taken, a complete history of the mother is taken, and also talking about the mother's psychosocial background, any drug use, alcohol use, medication she may take, how safe is her environment. All of these factors affect the outcome for a healthy pregnancy and a healthy baby. Also, during the first prenatal exam, there will be a complete physical done of the mother, making sure that her body is in the top physical shape to carry a pregnancy. During this time also, the doctor will talk about nutrition and how folic acid and calcium are important for the development of the brain and the spinal cord, the bones, the muscles of the baby. Weight is taken, and the doctor will discuss the amount of weight that is healthy for a mother. Also, they talk about exercise, and from my personal experience as a labor and delivery nurse, I have found that moms who have been physically active during their pregnancy have a much easier time at pregnancy. For some moms, this may include swimming, going to the gym, but even mothers who have had little exercise, formal exercise, can benefit from 30 minutes of walking daily. This will help to prevent some of the complications of pregnancy, the discomforts, and also to maintain a healthy weight. During the subsequent visits with the doctor's office, it is important to keep all of those visits. Each one allows the doctor a time to evaluate the mother's blood pressure, her weight, how she's feeling emotionally, and also the growth of the baby. Further into the pregnancy, as the doctor checks the blood pressure and the glucose test, complications such as pregnancy-induced hypertension or gestational diabetes can be identified early so that the baby is not harmed by these disease processes or complications, and you have a healthy baby. Finally, the appointments towards the end of the pregnancy will be, they'll go from every month to every 2 weeks to every week, watching for signs of early labor, bleeding, any problems like that can be identified early. And with early identification of possible complications, changes in the mom, then treatment can be initiated so that we have a healthy mom and a healthy baby.
My name is Judy Driscoll. I'm a licensed mental health counselor and I work with the Healthy Start program. Today I'd like to talk to you and the girls a little bit about the emotional changes during pregnancy. There are many changes that come about during pregnancy. Often mothers notice from day one of conception a change in their mood and attitude. There are a lot of reasons for this. One thing to keep in mind is that it's normal and expected that you will have a flood of emotions during your pregnancy, varying from time to different things. During the first trimester, there are several emotions that come about, mostly because of massive hormone changes that are going on in your body from the day of conception. The hormones that fluctuate during pregnancy increase in some and decrease in others. Definitely have been related to emotional changes. That's why we say that it's normal and expected. Another thing that can affect your emotions during your pregnancy, to be noticed especially during the first trimester, is your attitude towards a pregnancy. If you have been under stress, if the pregnancy was a surprise, all of these things come into play and can affect your emotions the day that you find out that you're pregnant. Another thing that can affect emotions during pregnancy is just your general physical changes that start occurring right away, that you may notice right away. Sometimes you start to get morning sickness right away, or you feel exceptionally tired. All of these things affect our moods and can cause, especially in the first trimester, unexpected tearfulness, crying for no apparent reason, mood swings, feeling very happy, then feeling very sad or stressed. All of these things can come about in the first trimester. It can be very upsetting at first because you're dealing with the news that you're pregnant. You're also dealing with talking with other people, the father of the baby, maybe friends and family, and there's a lot that can affect you. Also just worrying about how you're going to get through the pregnancy. All of these things start right within the first trimester, as you all know. For every mother, it's different. I can speak to that. I'm a mother of 3, and I can tell you that every pregnancy emotionally was very different. So for whatever reason, these changes will be happening, and you probably notice them at this point. During the second trimester, things tend to calm down a little bit. You feel maybe a little bit more adjusted to being pregnant. You're maybe not as tired. Morning sickness tends to subside in a lot of moms, not all moms, but a lot of moms. So you're feeling just better, you're eating better, you may feel a little burst of energy, which is good. Sometimes this is when mothers are said to have the glow of pregnancy, beginning in the second trimester. This is a little bit easier time. You're not quite as big physically, your abdomen hasn't come out completely yet. But you're starting to show, and people are starting to notice that you're pregnant. You can also become a kind of a sense of pride at that point about being pregnant, and you've dealt with some of the problems that you may have dealt with initially. You start to feel a little more confident. So generally, the second trimester is a little better than the first. Again, this varies from mom to mom. During the third trimester, again, things kind of creep up emotionally. You're getting closer to your due date. You're starting to get very large, very uncomfortable, can't sleep, so you're suffering from lack of sleep, exhaustion. You'll notice it's hard to eat because your tummy is so big, it's hard to put anything else in it. So your diet is a little different than it was before. Also beginning to think about how the labor and delivery is going to go, kind of wondering and worrying a little bit, maybe about how you're going to get through it. And then also thinking about what's going to happen after the baby's born and making some plans. So the third trimester can be a kind of a stressful period for some moms. It's very important to have good support at that time between family and friends, and if you don't have that, through agencies that can become involved. Healthy Start does offer counseling services to help moms through these periods. We also have support groups that are available to moms. Third trimester then ends with the birth of the baby, and there's a whole new period that we call postpartum. After the baby's born, you will notice that, again, there's a whole new flood of emotions. There's a dramatic hormone change, again, from your body going from a pregnant state to a non-pregnant state. With the hormone changes, you will notice that you may have periods of tearfulness, some sadness and depression for whatever reason. It really doesn't matter, it's just how you deal with getting through that. Being able to talk to people about those feelings. Also, what can affect you during that period is what your expectations were of labor, delivery, and a lot of times things like breastfeeding. If your expectations were that you would have an easy labor and you didn't, you'll feel some disappointment. If you wanted to have a natural childbirth and ended up having a epidural or some other kind of pain medication, you may feel disappointed in yourself, which you shouldn't. 60% or more of all women do that, even when they intend not to. So all of these things start to come about during the postpartum period, and a person can become depressed about that. Generally, these things subside. You will have the mood swings and it will go away. In some mothers, the postpartum depression tends to last. And that would be a case where definitely that mother should come to counseling. Sometimes a medication may help if the doctor recommends that, and support groups at that time are very, very helpful. I guess the good news is about all this is that Healthy Start does offer supportive services to moms, new moms and pregnant moms during the pregnancy and afterwards. So it'd be very important to find out about those services if those feelings don't subside after a while.
Hello, my name is Natalia and I'm here to talk to you about nutrition. Nutrition is important before your baby's born, after your baby's born. Keeping healthy and eating healthy is important to have a healthy baby, a healthy pregnancy, and healthy postpartum. So let's talk about a little bit about the requirements that you're going to need for when you're pregnant and thereafter. To start, you probably need just about 300 extra calories a day, which is not a whole lot. Maybe just a little tiny meal in addition to your normal eating. And this is for the second and third trimester. The first trimester, you don't have to worry about eating anymore. You just have to worry about keeping food down if you have pregnancy, nausea, and sometimes vomiting.